we're going to talk about emerald laser because this is really exciting science. So just a little background on me. James already introduced me earlier, but if you just logged in, I'm a board certified dermatologist in the US. I've been in practice since 1996, and I had the fortunate opportunity to have an outstanding education and training in dermatology at LSU Medical Center Department of Dermatology in New Orleans back in the 1990s. And I really say it was the birth of what we're doing now with laser technology. I date back to the time when we didn't even have the first CO2 lasers. We actually started out doing skin resurfacing with a diamond dermabrasion. And then the first round of lasers came through, which included CO2 resurfacing, some of the early pulse dye lasers that we would use for birthmarks. And back in my residency training, we were very fortunate to have Dr. William Coleman on faculty. If you don't know who he is one of the pioneers of liposuction. He actually worked out protocols that allowed us to do tumescent liposuction in our offices, in our surgery suites, without patients going to the operating room. And the reason that's relevant for our discussion today is that I'm looking back at almost 3 decades of dermatology and just realizing where we were back in the 1990s and where we are in 2024, and all the super advancements that have been made in technology that now allow us to contour areas of unwanted body fat compared to what was in the past thought to be the gold standard. And I think still there is some definitely argument towards, liposuction being gold standard, but not all of us are willing to go through a invasive procedure. For some reason, my advanced button is not working. Here we go. More technical difficulties. Okay. Let me see. There's the next button. Okay. So we all know, of course, emerald laser, as James just introduced us, is the first in its class. Low level light energy is so interesting to me because it's making such an impact on what we're doing to treat patients. I do several laser devices and low level energy devices in my practices. And we'll talk more about that as we get into some of the science, but kind of back to this gold standard. If we look at liposuction, this is literally a picture of where we've tumesced a patient to numb the subcu fat, and then we're suctioning out either laser assisted liposuction or just the good old fashioned, manpower to literally suction out the fat. And when I first started my practice in 1996, I did offer tumescent liposuction as a way to contour areas of unwanted body fat. And I would basically have to block out 4 hours from my schedule in order to do a body circumference liposuction, upper, lower abdomen, and flanks. And James and I were just talking earlier about exercising, and I always think about, just the hours of suctioning with that right arm, and talk about a workout. And I would get home and just think, wow, that was a really lengthy procedure. And as my practice grew and I became busier and busier as a general dermatologist and a cosmetic dermatologist, I just didn't have hours to block out to do liposuction. But I do remember the last liposuction I performed, and it was this pretty fit guy in his late 30s. He exercised, but he did have love handles. And despite, trying to give up pizza and beer, he just couldn't quite get rid of those love handles. So we blocked him out. I did his liposuction. And I remember just that firm, hard fat on his flanks, and just the contouring on his body and the toll it was taking on my body. And I basically put my tumescent liposuction cannulas down. I pushed the machine into the closet, and I thought, there's just other things I need to do besides suctioning people for hours on end. And that was about the time that some of the energy-based devices were making their debut. And so I still do some minor liposuction like chin, jawline, but there's so many devices that have come out. We can now kind of get away from this very invasive, aggressive, exhausting body contouring liposuction. From the patient perspective, not just me and the toll I felt like it was taking on my body, but after liposuction, patients have significant amount of downtime. They do have to wear a compression garment. They have a lot of drainage the first couple of days. So when you're blocking out someone for liposuction on your schedule, you're also requiring them to block out at least at least 7 to 10 days on their life schedule to stay home and take care of themselves post procedure. And a lot of people don't have the downtime. They really don't want to have to wear a girdle. They don't want to have to deal with drainage. They don't have to deal with risk of infection. And they really don't want to have to take off a significant time from work. So thankfully, as you know, technology advanced and science advanced, we ended up with a whole menu of devices that were basically targeting unwanted fat. Of course, I think we're all familiar with cryolipolysis. CoolSculpt made, you know, quite a big splash as far as literally freezing fat so then it would break down. The problem with CoolSculpting is kind of what we dealt with liposuction. There's some post-procedure downtime. There's pain. There's discomfort people experience. And again, you know, that's not ideal for every person. I get on the table. I reassure y'all, if I'm lecturing about it, I probably have had it done when it comes to a cosmetic procedure. And I've had some of these, you know, procedures that are listed on the screen performed, and I have a really high pain tolerance. So when I'm on the table getting a TrueSculpt ID radio frequency device and I'm breaking out in sweat and I'm going, how much longer is this going to last? Because the pain is real. It's intense. It's hot. Thankfully for things like these radio frequency devices, once the procedure's over, most people experience and should not experience any post-procedure pain. But during the procedure, you either have to have a really high tolerance or you've got to have some laughing gas or some type of a pain medication. So again, we're dealing with rate limiting steps, and then we can talk about HIFU. You know, are we seeing as much improvement as these devices we're expecting us to see? So I would say to my patients when we're just consulting over these devices, you're going to see about a 20 to 25% reduction of unwanted fat over a series of procedures. And then we start talking about cost. And, you know, because these devices are expensive for us to operate, because they're, you know, taking up a lot of time in our clinic for us to perform, that means the cost of these treatments is usually higher. So rate limiting steps, we're talking about discomfort, pain, downtime, cost of procedure, and the results marginally okay. It's okay. We're like, I've never been like, wow, these results from HIFU are amazing, or I've never been like, oh my God, the results from my last, you know, radio frequency, body contouring, TrueSculpt ID were outstanding. So we know we get some improvement, but we still had rate limiting steps. And I'll be honest, James, I was not in any point when I attended the American Society of Dermatologic Surgery meeting in November of 2023, even thinking about a body contouring device. Like, I was not there to look into that technology. I wasn't looking for another device to bring into my practice. And then somehow this Emerald laser comes up in my feed, and I'm at this meeting in Chicago, which is a huge, you know, national meeting in the US for dermatologists, and this Emerald laser. And I was just like, wait, what's happening? This looks, first of all, it looked really cool. I love the green light, and green's my favorite color. So I think I was like, wait a minute. And I do 532. I have a Star Walker, Photona Star Walker, that has a 532 nanometer wavelength of light. We've used it, you know, since the 90s when that first came out, but we think of it as high peak power. When we're pulsing over something with 532, we're usually intending to blow it up, like some tattoo ink. So I was really curious on how a device could be a low level laser that had a 532 nanometer wavelength. And so that caught my attention, because I only expected that to be, you know, selective photothermolysis laser technology. We blowing something up in the skin we want to get rid of. Instead, I'm seeing this data, this article I'm looking at on the Emerald, where it's low level energy. We're gently pulsing 532, and it's targeting fat. So this was one of the first discoveries on this slide on using Erconia's laser to target fat. And this was done in conjunction with liposuction. So right, we're back to the gold standard. In this protocol by Dr. I hope I'm saying this correctly, Rodrigo Niera,
Yep.
he basically used the Erconium low level energy Emerald, you know, 532, as a pre and post treatment. And he noticed that there was more emulsification. So that goes back. We have laser assisted liposuction. We know we can do a 1064. We can do some type of in the fat. We're putting that fiber optic in that sub-Q fat or deep dermal or deep fat, and we're heating it. So I've done that with 1064 with the Fotona. We have a fiber optic that we can use for laser lipolysis. But in this situation, it's not going into the fat. We're just using it over the skin. So we're pulsing that into the sub-Q fat. And yet here we are showing that we have emulsification of adipose tissue. So that I think was the first aha moment. And then from there were more studies done. This one's very interesting. If y'all are science nerds like me, you want to pull these articles out of the medical literature and read them because they're very interesting. And this one showed MRI emulsification at 6 centimeters of depth. Now that's getting like, wait a minute, what? Because, we're going over intact epidermis. We know lasers can penetrate. We're usually using ones that have a certain depth where our target or chromophore is going to be. But yet in this MRI, they're showing that there was actually emulsification down to 6 centimeters. So we've always told people that we can only get sub-Q fat. We can get what's between the skin and the muscle, but we're never going to get intra-abdominal. But yet here we've got something that's going down to 6 centimeter, and they're seeing this on this MRI of abdominal tissue. So I think again that was another aha moment, James, in what the research was revealing.
Absolutely. And I think the aha moment to a lot of this too was even surprised us. And that's kind of the adoption of this technology, which some people don't realize. A lot of the original content that was used for laser therapy was post-operative care. We've done a lot as a healthcare company for chronic pain and other issues for soft tissue and deep tissue. So we were kind of amazed even some of the results. We started with red laser 635, then we graduated to 532 because we found out that we could get deeper energy into the body, and then started to affect even other areas of the body, just the cellulitis too as well, collagen synthesis, so it affected that. But I think the real thing, which I'm sure you're going to get into here pretty soon, was the fact that we could treat patients that were much larger, which other technologies were not able to do. And that was a real aha moment for us.
Yeah. So these are just really cool pictures here of looking at the adipocytes and looking at what's happening as they're being exposed to this 532 nanometer low energy light. There's another, few pictures here that kind of show us at the time intervals of 1 minute, 6, 12, and then 18 minutes later, what's happening at this cell membrane level. And we're basically seeing that this gentle wavelength pulsing into this subcutaneous fat is actually causing transitory pores that allow the fatty content to escape. It seeps out. So it's basically depleting the cell from the excessive adipose tissue that's inside the cell membrane. So that was really interesting and exciting to see this, that just after 6 minutes of this laser exposure, that this starts creating this transitory pore and we get this liquefied fat seeping out. Here's some more images of what that looked like and how they were able even to measure that there was up to 80% disruption of the adipose membrane within this exposure time. And then we have this really cool video. Nothing's better to watch than a cool video showing fat cells leaking out adipose tissue or fluid into the surrounding cell outside the cell membrane. Now, of course, what's going to happen to this this extruded adipose tissue, and it's going to be picked up by the lymphatics. And so part of the protocol in my practice is that once they've had their emerald laser treatment, which is a 30-minute session, we'll actually have them get on this little vibratory plate, one of those lymphatic massage plates, just to kind of shake things around and get that lymphatic going. We have patients walk afterwards. We don't want them to just go sit down and be sedentary the rest of the day. So we want to get the lymphatic pumping and flushing this out. James can speak more on this as well, and there might be another reference in the slideshow about this as well. But there's no increased elevation of their triglycerides or their cholesterol in their blood levels. We're not going to deal with that risk of flushing a lot of triglycerides and fatty acids into the blood and causing some crisis. This is going to be flushed out strictly through the lymphatic. Here's another little cool video where you can see upon exposure this pore opening up, and it's creating that gentle wounding to the tissue. And I think, James, you can also speak to this. The safety profile on this procedure is extremely high. We don't really have any risk or post-procedure procedure contraindications or post-procedure high risk. Like, of course, I think one absolute contraindication would be pregnancy. Obviously, we wouldn't want a pregnant woman coming in and trying to get rid of fat. We'll wait till after the baby's born, and she certainly will want to come in at that point and get the treatment done to get her mommy body back into shape. But yeah, there's a lot of research on this procedure, and a few more slides. I want to show you this one because this is what caught my eye. Is just seeing this device in action. Here's the screen. Here's the patient laying there. You have these beams of light. It rotates. There's 10 heads on the machine at different angles. You can adjust it up and down. You can actually adjust the width by kind of closing down a little bit on the width if you need to on a smaller person, or going out wider for a larger person. So it's beautifully designed. I don't know the engineers yet, but they did a remarkable job on, I think, designing a device that's extremely user-friendly in a clinical office setting and really comfortable for a patient to target a 360-degree circumference procedure to target body fat. The next, here we're going to talk about some studies, and James, I'll let you jump in. But this was one of the initial studies looking at this below 30 BMI, looking at a protocol of 3 treatments a week. They did 2 weeks. Patients were not allowed to change diet or exercise. They were, told just to continue on their same daily routine. And then they reported this, significant average reduction of fat, inches reduction. We're not talking about weight loss here. We're talking about reducing inches. And I think that's as important for people as what the scale shows. I made a trip to Italy one year, and we ended up at this beautiful Prada shop, and I bought a skirt that's outstanding. There may be feathers on it, and it zips up, and it's perfectly fitted. So my litmus test for myself is not how much I weigh on a scale. It's, can my Prada zipper zip all the way up? And if it cannot, the Prada zipper will never lie. She would be like, girl, you have got to go get on that Emerald Laser or cut back on some of the snack food or whatever I might be eating. A trip to New Orleans where you can gain 5 pounds in a day and a half. So, we really want the scale to be a good weight health-wise, but we want our clothes to fit well. We want to reduce inches of unwanted fat. And that's why I think this is such a breakthrough. And this study shows, these great results that they were able to achieve with their protocol. This is the other one that's important because this one actually showed what's considered more obesity, and that's the BMI of 30 to 40. Now you've got people who really need to lose fat because they're at a very unhealthy, high risk for heart disease, metabolic syndrome. I think these patients definitely can benefit from this procedure, and I have several that have come through my practice to have it done because they need that extra motivation, that little extra push to start seeing the fat coming off. And not only that, we do know that we're helping to make them healthier by getting this excess fat out of their body. I do recommend for patients, if it's something that they're interested in, combination therapy. We certainly start out with our patients counseling them on diet, nutrition, exercise. I think it's imperative that people understand you really need to, get your body moving. You need muscle. You need to get your heart rate up to be a healthy person. So exercise is super important. And then, of course, recognizing nutrition. So much of our food, especially here in the US, is just laden with unhealthy ingredients like excess sugar, excess calories. It's not just the food we're eating, it's the beverages we're drinking. You'll see people holding these, huge cups of Starbucks coffee and they don't even realize they're just sucking down 50 grams of sugar and about, 800 calories. And nobody can understand why they won't lose weight because all they do is drink coffee. But you've got to, really talk to people so you can help educate them on nutrition that's not just something that tastes good, but what is it doing for your body? If I'm looking at a donut, I'm gonna say, what are you gonna do for me today? You're gonna make me feel bad. You're gonna make my skin break out. You're gonna make me fat. Let's get rid of that. I don't want to eat something that's gonna, work against me. So once we've consulted our patients, we've gone through this nutritional, you know, conversation, trying to help them make positive life changes. The Emerald Laser is just the next step for them to start getting things happening quicker. And that's the other great thing about these treatment protocols. We're not talking, 6 weeks, or excuse me, 6 months down the road. We're talking about treatment protocols that, like this one on the slide, 3 treatments a week for 4 weeks. They take 30 minutes. There's zero downtime after their procedure, other than we want them to walk, move, or get on that little vibrato machine. There's no pain. And that is really, to me, what's been a game changer for this device, where we can compare it to, say, the TrueSculpt ID or any of those radio frequency devices that are for body contouring, or even a CoolSculpt that can take a lot longer and cause discomfort. This one's a 30-minute session. We don't have pain at all during the procedure, and we don't have any pain or risk after the procedure either. So that reaches a lot more people. A lot more people are like, man, I mean, what's the downside? And really, in my medical opinion, as far as downside, as far as any risk or potential complications, we don't have to deal with that with this device. And we do see results. So I guess it's just, the money they spend and the time they take to come get it done. And so I think people, when they're looking at their budget, their lifestyle, they're not having to take off weeks from work to get liposuction done and recover from it, or at least a week. This is certainly more accessible for the majority of people that I talk to who want to get body contouring done. Matter of fact, a lot of my patients, I'm just like, we could have done a treatment while I was just talking to you about it. Like, we literally could be doing it right now, right? Well, I should be doing this on the Emerald. I should have done this while getting a treatment. Oh, well, I tried to get one yesterday, James. I couldn't get on the schedule. It was booked.
No,
So,
and you're bringing up a lot of valuable points, and it's
yeah,
good to hear you with it, with all your background and have experience to bring in
yeah,
a technology like this after everything
yeah,
that you have and there to offer your patients. And I think that's a big question a lot of these providers want to know, and then I know I personally hear about all of the time, is how do you bring it in? How do you incorporate it with what you're already doing? And I think the
yeah,
number one thing that you would mention is educating the patient on this is how it has to happen. There's not a one thing fixes all. And as you know through all your experiences, adding things together to help get the outcomes is
yeah,
the best thing. And I'd say that's the one thing with Emerald that we always like to discuss is it's flexible and we can tailor it to most any patient and their needs. As you mentioned, there's no risk, there's no contraindications, no ill effects that have proven with this laser technology or any of our lasers. Obviously, the pregnancy correct, you would not want to do that, or active cancer. But besides that, any
right.
patients that with different skin color, pigmentation, prosthetics, metal plating, implants, you can treat all of those different types of patients and structure a treatment package that can fit those patients that might not be able to get other treatments and other services, and introduce other things that can help get them to that goal faster, like the lymphatic stimulation and nutrition. So that takes the average inch loss, in my experience, around maybe 5 or 6 and increases it to a few more. So structuring something for the patients, the best goal as far as them looking better and feeling better and having a better outcome when you're looking at your overall health for the patient, and not just look, but that's where this comes into as well,
Yeah,
as it's safe and it's a good procedure, because we've seen some other healthcare benefits because we use these lasers. And green laser, for those who are not familiar, was FDA approved on our healthcare side too, just back in 2022 on one of our other healthcare systems, using it for chronic pain when combined with violet laser. So there are
yeah,
other aspects to where it's not a contraindication, but a positive effect as you would
yeah.
see from it.
Yeah, and just anecdotal report from a patient. We never ever discussed with them that, there's some indications of use for muscle pain, but he just started saying to my laser tech, man, since I've been getting the Emerald, it feel like my back is feels better. I'm not having that ache. And we're like, oh yeah, by the way, maybe it is because of the laser. So yeah, there's that science too. And like if you're a practice that does still offer liposuction, I think you can go back to that first report with Dr. Naira and say, well, hey, maybe I'm going to do some emerald before my laser before the liposuction. Might make it easier for the clinician, and then use it afterwards. I know, for the 20 years I did liposuction, you still have a few, sometimes it's the peri-umbilical area. It's hard to really kind of sculpt every bit of that little fat out. So I could see where this could actually be a nice adjuvant post lipo to further reduce areas that just weren't completely sucked out. We're not going to get 100% of it with lipo either. So I think this could be an adjuvant even in clinics that are offering liposuction. I do have a Fotona SP Dynamis. It's an outstanding laser, which is a multi-platform laser system, and we do it for skin tightening and contouring. So when I was looking at investing in this technology, I thought, well, why do I need this? And for sure, one reason is because I can't do a 360-degree circumferential tight sculpt or tight contour without it literally taking my laser tech probably at least an hour and a half. And it's just a lot. The way the hand pieces are, it would be really difficult. So we would have to say, and we did for years, say to those patients, well, we'll start with an area and then we'll work around to other areas of concern. So now we just give them options, but it's certainly, this is for the people who want multiple, the full circumference. They want the anterior and the posterior and lateral areas treated. And we do that in one session, where you treat the front for the 15 minutes. And then the machine stops at 15 minutes. I don't know if we explain that at all at this point. When you have a patient for a session, they come in, we measure them, we make notes about, what their concerns are and take a lot of photographs. And then we have them on the table, either starting with them face down or face up, and we'll start the device, and you'll get 15 minutes of delivery of energy. Again, you feel nothing. So usually, people are scrolling on their phone, or sometimes we'll offer a little facial massage while we're treating their front. And then when we finish that 15-minute session, the machine will stop, and that gives you time to readjust this this handpiece area, and then roll them over, and then you set it again for the next 15-minute cycle, and then it starts automatically. Most of the time our laser tech doesn't stay in there with them. She's going to be back in after the first 15 minutes, and they have their little timer so they know they're back in there before the patient, the machine stops. Roll them over, readjust, get the machine set up, start again. And so people are very comfortable. They usually don't prefer to have someone stay in the room the whole time, because then you're just kind of left with this either uncomfortable, like I'm laying here in my underwear, and this, laser tech's chatting with me about, what's going on. And I kind of just wish she'd leave the room. So we're safe to leave them in the room. They're not needing us to supervise them. They certainly, can contact us if we need to come back in quickly, but there's nothing that they need us to come do except readjust the apparatus, so to speak. And so it's comfortable. Patients are relaxed. They're comfortable. As I mentioned, we've even had a little promo where they could get a complimentary little facial massage while they're, doing their first 15 minutes. And so there's all kind of little add-ons you can include with this procedure. But because it's painless, because they're not uncomfortable, because they're not having to take off work, it's a really quick and easy. They come in, my busy working patients, a lot of men have gravitated towards this procedure. I'm not saying that y'all have a low pain tolerance, James, but I'm just saying that when you tell the guys it doesn't hurt, they're like, yeah, I'm in there. Yeah, let me just come swipe a credit card and get on the table if it's not going to hurt me. And so they like that. They're all about quick and easy and painless, and not having to miss work except for the maybe 30 minutes. Well, 30 minutes they're in the device treatment, and maybe the 10 or 15 minutes checking in and out. We currently have a protocol where we can have them come in twice a week for a series of 10. Sorry, my light keeps going off. A series of 10 treatments twice a week. There's 3 times a week for 4 weeks for patients who are trying to, get things done quicker. Some patients, it's a little bit harder for them to come in for 3 times a week. for a month, but twice a week, almost everyone can make that work with their schedule. And we're seeing, excellent results with that. Speaking of results, are y'all ready to see some?
Mhm.
Okay. All right. Are there questions, James? I know we've got, maybe the option to answer a few questions before we get into clinical results.
Yes, so there is some questions we had previous and some ones coming in here. One that did come in is asking, is it contraindicated to treat patients over 40 BMI? I can answer this. It's not contraindicated. The research has only been done on patients from 20 up to 40 BMI. We do have some medical weight loss facilities that do treat patients and have in the mid to high 40s, so you can structure it. That's just what the clinical trial data has showed us so far. So we are going to be doing some expansive research. We are going to be looking at testing those patients, but there's no ill risk to treating those types of patients. You would just have to adjust the treatment protocol to be longer. So for those types of patients, we can adjust and treat those patients. It was just going to take them longer to get the type of results that they're looking for.
And I've had patients who have finished one series of treatments and said, hey, when can I start back again? I want to add another area, or I see improvement, but I just want to keep going to get more.
Mhm.
So again, can you speak on that, James? We're not maxed out with 3 times a week for 4 weeks or twice a week for a series of 10. We just have to start somewhere, and then we like to see where we go from there. Did we achieve your goals? When people ask about, and this happens with all cosmetic procedures, well, how many treatments will it take? Well, it depends on where you're starting from and what your goals are. You can take someone who's got a pretty substantial girth and reduce them by 4 or 5 inches, and they're elated. I mean, they've never been in pants that, were 5 inches smaller. Or you can have, the me's out there. They're like, no, when I lean like this, I still see that, and I want more, so there's everybody's kind of individualized treatment, I think, is what you really have to focus on. It's not cookie cutter. We're not all starting at the same place. We're not all going to have the same happy endpoint. So I think it's just, gauging that individual patient's level of satisfaction, what their goals and anticipations are. But photographs are really important, and measurements, because you will get occasionally that patient that says, well, I can't see any improvement. And then you show them their before and they're like, was that me? And we're like, yeah, that was your before body. And they're like, oh, okay, well, I do look better. So you got to be able to visually show them too. I would ideally, and we're going to work on this protocol in my office. Ideally, you want them to wear the same thing on the first picture that they wear on the mid, way through picture and the very last picture. And I think another thing too, James, that I'm going to work with my staff on is that we're really not done when the last procedure is done. They can continue to have some improvement even after the last treatment. I think in one of the studies, was it up to 4 weeks? They
Um,
still had some reduction.
I'd say the probably most accurate is going to be up to 2 weeks. They'll still
Okay,
be
2. Okay.
processing the liberated fat. So I think that I'd say up to 2 weeks. Any further than that, it will be tough. Some patients now, again, as you mentioned, it's not just a cookie cutter. Some patients' lymphatic system, if it is flushing it properly and efficiently, it can continue to flush the liberated fat even after that. But I usually tell it's safe to say at 2 weeks. And you're right, there's no limit to as many treatments as long as it will keep processing the liberated fat. You can keep continually doing treatments. There's no oversaturation of that. There's no risk in it. I know a question came in it looks like it just came in about burning. It is a non-thermal photochemical based laser, so it cannot burn. It's not even a laser diodes aren't even possible to do that. So you don't have to worry about any type of burning or overstimulation.
Right. Okay. All right.
And
So our
then
first,
if
okay.
did you
Is
want to
there
go
no,
over? There's more questions that keep funneling in. If you want to still do questions, we can do that.
yeah,
It,
let's do a few more
yeah,
questions, and then we'll get into, like, I think we just have a few case reports, and we probably would have about 15 minutes left.
yeah. Roughly, we'll go about
Time
another
flies.
15, maybe 20,
Okay.
depending on the questions that come in. But does it help increase results? It looks like the question in by adding other treatments and services. I apologize. You had mentioned nutrition. Does
Yeah.
it pair well with a Ozempic
Yes, for
semaglutide type
sure.
of drug
Yes.
as well? Okay,
And
go ahead.
yeah,
I'll
for
let you.
sure. And we offer that for sure. I've had patients who either were reluctant to get on the semaglutides, either because, you know, it wasn't covered by their insurance. And they really weren't sure about, you know, their out-of-pocket expense, or they just were a little concerned about potential side effects. But I think semaglutides are, I'm calling them the 24 version of Botox, you know, circa 1996. You know how back in 96 Botox was like, oh, you're doing what? You're getting Botox, and it was kind of like a little bit of a taboo. And now all of us are like, yeah, we neurotoxin for sure. So I think the semaglutides are playing a role on helping manage, you know, our modern obesity problem, epidemic, we'll call it. I think that we have to be really careful when we're prescribing these medications, that we're monitoring patients very carefully. We're helping them, we're coaching them through that process. I think the anorexia component is a real concern when you see people go too far, too long, and too high a dose, and they literally get muscle wasting, just too much weight loss. So I think if you're pairing Emerald with semaglutide, you want to be very mindful with that whole systemic drug therapy and how you're affecting that person's you know, weight loss journey. And I think as long as you're doing it very mindfully and you're using the Emerald as a jump start to start reducing those inches, to start, I loved your term, liberating the fat. Like the poor fat's just been stuck there and it can't wait to get out. But yeah, let's liberate fat because we want it out of there. We want it to get flushed through the lymphatics and not be stuck in our adipocytes, causing trouble. So I think that's important to give that person that jump start in conjunction with a start out dose, which is usually low with semaglutide. You want to build them up on those weekly injections. And then once you kind of get them at that ideal dose where they're seeing the weight come off and we're seeing the inches come off, then we've made it that patient really happy. And I think we've also made them a lot healthier than being obese, especially that 30 to 40 BMI group. And back to that question earlier about using it for people with a higher than 40, I think those are the ones who really are going to benefit from a semaglutide approach to help them start, you know, working on reducing that caloric intake, and I'm sure those patients are going to have an elevated hemoglobin A1C. So you're really helping to reduce their risk for diabetes and heart disease and all the things that go along with obesity. And then with the Emerald, we're helping them to visually see that fat shrinking, and we're fleshing it out by liberating it. So I think the two work beautifully together. I think it's a win-win for people. And when we're doing it smart, with clinicians, you know, being very educated on that and being careful with how they're managing their patients, that we're going to give people optimal outcome.
No, that's a great answer. And that's exactly what I was going to say too, is I hear from a lot of my providers, that's what they're doing, as you had mentioned, with their weight loss journey, is starting on the small dose of a
Yeah.
semaglutide to help jumpstart them, and then combining the Emerald laser, which will help with the therapeutic applications to help reduce the loss in elasticity, the muscle loss too, and then they're not stuck on a high dose of the Ozempic, and that kind
Yeah.
of gets them to where they need to go. So it is
Yeah.
a great combination that we see a lot of providers using now.
Yeah. And then there's no contraindication for the two treatments. So it's not like you can't do the Emerald if they're on a semaglutide or vice versa. So because you know there's no contraindications other than what we mentioned was active cancer or pregnancy, you can actually start them on that drug in conjunction with their Emerald laser. So we love that option. Okay, so I'm going to just show you. This is our skeptic. We're going to give him. He's called the skeptic. So this gentleman, 59-year-old male, who was completely skeptical that he could lay under this green light and look at his emails and you know text on his cell phone, feeling no pain or discomfort, and lose inches. He is a husband of a friend of mine, and we were actually just discussing at dinner one night this new device I was going to bring in. And he's like, there's no way this is going to work. And I said, okay, come on, let's try it out. So he comes in, he does the twice a week, he does a series of 10. He changed nothing about his lifestyle, except I actually know that he was going to challenge me by drinking a little bit more beer. And we went to New Orleans a couple of weekends. And I don't know if any of y'all been to New Orleans, but you can gain 10 pounds in just a heartbeat. So he goes down, has fun. He's having a, good lifestyle. He didn't want to change anything. And his inch reduction was quite impressive. He went from a 42.5 inch waist down to a 37.5 without doing anything but challenging us with a little bit more caloric consumption. And yet he still lost these 5 inches and 6.6 pounds. And he was delighted. He was now our biggest advocate on how amazing the results are. I apologize for the after picture being a little dark. I don't know why we didn't get a little bit better lighting, but I'll have him back in for some more after pictures after seeing this one. You can see with him standing, arms out, not sucking it in either before or after, how much less adipose tissue he has on his anterior abdomen. And you can see how good the skin tone and quality looks. I think that's another, again, not the best after picture because of the shadow, but having done liposuction for so many years, we would often have to tell patients, look, we may have to do a little skin tightening afterwards because we're going to suck out this fat and you might get a little crinkly and wrinkly. But because we're using this low level laser energy, I think the skin quality really looks good too. He had the 360, so you can see that, he didn't really have a lot of back fat on his love handle area, but still you can see where the contour on his back is straight and smooth, and how much less adipose tissue he's got on that anterior abdomen. So our local clothier was really excited too, because he had to get, new pants, new clothes, because everything was too baggy and saggy after the treatment. So he was really happy. You can even read over here in his testimonial how much, he enjoyed these results and how well he thought this worked for him. This is a young lady who we only did her lower abdomen. We did the 30-minute treatment where we did from her mid abdomen down, and she did the 15 minutes front and back. And you can see how much she lost if you compare to where we didn't treat, no reduction whatsoever above or around the umbilicus, but on the lower abdomen, how much better this looks without the bulge over the panty line. And again, someone who did not make any modifications in her lifestyle. A lot of fullness on her lower abdomen. We've got this little adipose tissue that hangs down over the waistband, and over here, although we have black panties on with the black background, doesn't give you that nice little sharp visual, but you can definitely see where there was a nice reduction after her treatments. And here she is from behind. And again, you can really appreciate how much less adipose she has on her lower flanks. So she was very happy and would certainly want to do her upper abdomen on her next round of treatments. I thought this was a very impressive result. This was not one of my patients. This is from Erconia's portfolio, but really nice to be able to reduce this submental adiposity with something that's not painful. And the nice thing about the device is you can certainly turn off some of the lamps. So if you're trying to hone in on a smaller region, we can turn off on this touch screen some of the lamps that you're not wanting to use to target. So it is adjustable both in the width and the height of the machine, but also the number of lamps that you're using during the exposure. Another result where you can see this patient looks much smaller because she's lost a significant amount of that mid-abdominal girth. So these are some really impressive results as well. So I think that wraps it up as far as, our webinar tonight. Still, I think we probably have a few more questions, James, if we want to maybe go another 5 minutes.
Yeah, we'll spend another 5-10 minutes going through some things. I know I have some people that are asking regarding some of the pricing as far as, how do you price your treatments? What's the cost of the system? Things of that nature.
Yeah.
Do you want me to cover that some more right now? You want to go over some of the other questions?
Yeah, I mean, I think you can definitely discuss, the price of the system. What we charge in my practice, we started this in February, so I'm really new to the game with Emerald. I think we're probably around 30 patients who've come in and had this done. We charge $2,200 for the series of 10. So about $220 a treatment, which is not, a lot for what they're getting, but it's an easy treatment. It takes very little time from my staff. So, if that's something that, attracts our patients and they want to come in and get the treatment, it seems like a pretty reasonable fee for us to charge. And we could probably go up, but we were just kind of wanting to get our feet wet and get the reputation for the device built up and grow the demand, which has. Again, we had over I guess we had 12 patients on schedule yesterday. And it's a 30-minute treatment. So I have one designated laser person who's going in and out of the room, getting those patients set up, but you can also go into another room while, they're under treatment, do some more treatment. So yeah, we've been very pleased with it in my practice.
Okay, yeah, that's great. That gives some really good insight because we do all of the training support for it as well. Each account has a clinical education coordinator that comes out and does the trainings, help set up the launch of the device. So we try to make a hands-on approach to everything that we do. So we want them to let everybody know about everything that we like to do. Is we like to be a part of the process, no matter which laser you're getting invested in. Thank you. We've gone through quite a few questions. Want to keep this at about an hour. But for those who didn't get all their questions answered, you can contact me, or if you have any more questions for Dr. Hopkins, we'll be happy to send those over to her afterwards. That way we can help answer any questions that they can get answered this evening.
All right. Well, thank you, James. And thank you everyone who participated tonight. I hope it was informative, educational. And I appreciate you inviting me to come on, James, tonight and discuss my experience with this really cool emerald laser. All
Yeah,
right.
absolutely.
Yeah.
We
Well,
appreciate your
thanks.
time this
Yeah.
evening.
All right.
Everyone, we appreciate you being on. Hopefully you look forward for more, and we'll be in touch. And Dr. Hopkins, enjoy your evening. Enjoy
Thank you.
everyone the first night of football, and
Yeah.
hope
Take care.
everybody has a wonderful weekend.
Thank you. Take care.
Bye.
Bye-bye.